Hello, thanks for tuning in. Today I'm going to explain history taking and secondary assessment with you. Note, history taking and secondary assessment take place after your primary assessment. You should start with some history taking. Use the acronyms Sample HER and OPQRSTT. Sample HER stands for signs and symptoms, allergies to food or medications, what meds the patient is on and the last time they took them, past medical history, has this kind of medical situation happened before? If yes, when, and does it feel the same way? Then their last oral intake, when was the last time they ate, events leading up to the medical problem, habits, do they have habits of drugs, smoking, alcohol, things like that. Then their environment, how are their living conditions? And then risk factors. Are there any risk factors that could worsen the situation? Then OPQRSTT stands for onset. When did this start and was it sudden or gradual? Provocation. Does anything you do make this better or worse? Quality. Can you describe the pain? Radiates. Does the pain radiate anywhere else in your body? Scale. How bad is the pain on a scale of 1 to 10? Time. Is the pain constant? And treatments. Did you try anything before we arrived? Then you'll start your secondary assessment at the head. Start by using the HEENT acronym. HEENT stands for head. Is the head symmetrical? Eyes. Check their perla. Pupils equal, round, reactive to light and accommodation. Then check their ears. Is there any discharge from the ears? And then you'll check their nose. Is there any discharge from their nose? Then you'll check their throat. If there's any trouble swallowing or sore throat. Next, check the neck for jugular vein distension, tracheal deviation, and confirm C-spine. Then you'll move on to pulmonary by listening to the lung sounds on the patient's chest and their back. Next, you'll go on to cardiovascular. Assess the patient's pulse motory sensory and in the hands and the feet. Have them squeeze their fingers and wiggle their toes and see if they feel you touching their toes. Then check the patient's capillary refill, which should be less than 2 seconds. Then you'll assess the patient's pedal pulses and check for pedal edema. The next step is used as needed. Palpate the patient's abdomen and pelvis, a neuro exam of the cranial nerves 1 through 12, and going through the Cincinnati stroke scale of fast, facial droop, arm drift, slurred speech, and then time, and whether there's any numbness or any tingling. Then you'll move into a psych assessment, mood, appearance, speech, and thoughts. Next, you'll obtain a set of vitals from the patient. This includes a temperature, pulse rate, respiration rate, blood pressure, O2 saturation, and glucose, and if need be, get a end-tidal CO2 and an ECG. Then you should have a diagnosis of the patient for everything that you can do as a paramedic. Then you will verbalize your patient treatment plan with the patient and call for appropriate interventions. Then you'll perform the treatment in a timely manner. After all that, you will reevaluate the transport decision. And lastly, you should continue to monitor the patient and reassess them every 15 minutes for a non-critical patient and every 5 minutes for a critical patient. Thanks for tuning into this video on how to perform a secondary assessment on a patient.